Good morning. This is Dr. Ed Buckingham, and today I'm going to talk to you a little bit about what we call a limited incision lower facelift. And understand you're not going to find that terminology anywhere else on the web. It's something that's unique to our practice, not that it's necessarily a unique procedure, but I'm just not a fan of calling things by gimmicky names. I know that sometimes practices like to brand things and market it. I just like to give educational content, and so understanding that it's not necessarily the best name because limited incision implies that there are limited incisions, just like the name, but what it really is a limited dissection. Unfortunately, when I say the word dissection, people don't necessarily know what that means. So just understand that we're still making incisions around the ear, and we'll go through that in detail, but what we're not doing is we're not opening this entire anterior neck compartment, and so therefore the dissection, or the amount of tissue that we're actually interacting with, is less, but it is still a real lift that gets real results. It is tailored for individuals who don't have anything fatty or glandular or anything else that needs to come out of the neck. So they have thin necks. They don't have a ton of neck laxity. So you can have some lateral skin laxity and things like that. So definitely patients who need improvement in their neck but don't have a big waddle. And so those are the ones that are candidates for this. So what we're doing is we're doing all the work from lateral, so all the dissection is just done around the ear, which means that all the bruising and swelling is kind of here and here, and so your recovery is really quick, especially in your female patients who've got a hairstyle that they can kind of pull their hair over the incisions. You can literally, with sutures in place, be at the grocery store getting milk and eggs on day 3, and nobody's going to notice you had anything done. The other nice thing about this is you can do this with some really light or even no anesthesia. So I've got some patients who just don't like the idea of being out of control or being sedated, and so they just come on in, we just inject lidocaine, the numbing shots, numb them up, and you can totally do this procedure with somebody wide awake. We talk about their dogs or their kids and just do the procedure. Most people will do this with a little bit of IV sedation or just pills, so we call that oral sedation. So it's a sedative pill, an anti-nausea pill, and a pain pill. And what that is that they sit around in a recliner for about an hour and kind of let those medicines absorb, because unlike IV medications, it takes a bit for those to hit the system. And then they're pretty goofy. They can still walk and talk and interact with us, but they're very forgetful and very relaxed. And once I'm done injecting the numbing shots, most people will just kind of sleep through the procedure. So specifically what we're doing is we're making an incision around the ear, and this is typical for our facelift incisions, and it is the same incision we're using for bigger facelifts, designed to be hidden and not move the hair around. So like this sideburn, especially in a female patient, I don't want that sideburn to be up here when we're done, and you want to get a vertical lift. And so if this is attached to what you're lifting via an incision that goes up in the hair, now you've made them kind of bald in front of the ear, and that's one of the stigmata of facelifts that just doesn't look good. So we're going to lift up that sideburn. We're going to make the incision right along those hairs in a curvilinear fashion. So now what we're lifting is not going to include this. And then even if your hair's up in a ponytail, that little swag will always hide that. We do the same incision in men kind of coming through there because beard hair is kind of coarser and less fine than head hair. So we find that junction and cut through there, and then when you lift vertically, it just reestablishes that hairline, so that incision ends up really kind of covered by a little bit of a sideburn hair if they want to. So then it continues in front of the ear, but just this segment, and that's a nice shadowy spot to hide it. Then we dump inside behind this little cartilage called the tragus. So we're literally going inside the ear behind that to keep any incisions from being out here. Then we get from this little notch around the earlobe, and then you can't really see behind my ear, but if you can imagine, the ear visually from a point kind of covers the hairline. So we stay in the back sulcus of the ear up to the point where the ear kind of covers the hair visually, then across and then down the hairline, not into it. So again, when you're lifting, you don't create this abnormal step off in the hair that you would see when your hairstyle's up in a ponytail. So that's the incision design. And then what we're doing through that is we're going to elevate the skin just far enough to get access to that deep layer that everybody talks about, the SMAS, S-M-A-S, superficial muscular aponeurotic system. That's an acronym, or people commonly just call it the muscle layer. It's really muscle in the neck, the platysma, and then that layer comes up into the face and it changes names to SMAS, but it is literally the same anatomic layer. And that's important because that's what's going to lift, and that muscular layer is attached to all this skin in the neck. It's attached to the jowl and attached to the marionette fold. And so when you do this lift, you're getting an incision into that SMAS layer. You're lifting that SMAS off of the deeper structure, which is the parotid salivary gland and that fascia. And usually we're going to elevate that all the way out to the front of the parotid salivary gland, but not necessarily progressing to a deep plane in a lot of people, especially if you're doing this with oral sedation. And again, These people generally have kind of less aging in the neck and face, so you don't necessarily have to do the ligament release and the anterior dissection over the facial musculature, which defines it as a deep plane, but at times we do. So if I have somebody who's got a lot of cheek dropping, we call that ptosis, and they could really use a little bit, we'll do a deep plane limited incision lower facelift where we extend that subsmass dissection all the way out in the face, releasing the zygomatic cutaneous ligament, mobilizing the cheek, and get that vertical lift from the limited incision approach. And so after that procedure, of course, everything is stitch closed. We use something called fibrin glue to glue down the skin. That minimizes bruising and swelling. And then they get wrapped up with a dressing overnight, just that one night. You're home. We don't keep people overnight in a facility of any kind. There's no reason to do that. The aftercare is super easy. So drive her home, drive her back to clinic the next day. Wraps come off. We don't use any elastic support garments or rewraps of any kind. There's no drains. And so you're basically just going home, icing for a couple of days, sleeping a little bit head above your heart. Sutures come out at a week. And then again, the beautiful thing about this, because this limited dissection, all the bruising and swelling is pretty quick and easy. And so, and even if you come in with some more significant bruising on your neck than some individuals have, we've got a device called broadband light, or BBL for short, that we can treat bruises with, and that'll kind of get those gone. So pretty much everybody is able to be social starting about day 10. And really, again, even if you style your hair appropriately, you can be social before that. But really, sutures out, hair tucked behind your ear, all that sort of stuff. Day 10 is pretty much the time frame for being social. So that just works out great. Really strong improvement in the jawline, equivalent to a bigger lift. Again, the limiting factor is the neck. So if you got something that's going on in the neck where it's really saggy, fatty, something that entails a need to open up and do this incision, then of course we do a bigger procedure. But people who've got the appropriate anatomy for it, this is a great procedure to get you a really nice substantial lift with minimal recovery and downtime. So thanks for listening. I hope you enjoyed.